Hello, my name is Jonathan White. I'm a fourth-year student at Wake Forest School of Medicine. This presentation is a part of a series created by the Radiology Scholars Certificate Program that considers high-yield concepts in radiology. This presentation will serve as an introduction to breast imaging. This is an outline of the presentation. We'll begin with mammography, paying particular attention to tomosynthesis, and then we will cover ultrasound and finally MRI. Mammography can be divided into its screening and diagnostic components. Screening mammography allows for early detection in asymptomatic patients. Annual mammograms begin at 40 years old for women of average risk for breast cancer. Generally, 2 views are obtained, consisting of craniocaudal and mediolateral oblique. The amount of radiation involved in a traditional mammogram is equivalent to the background radiation exposure of a flight across America, so these are considered to be low dose. Diagnostic mammograms can be performed in symptomatic patients who present with specific breast symptoms such as a palpable lump or nipple discharge. Additionally, asymptomatic patients may be called back from screening mammograms for additional imaging. A third scenario includes patients undergoing surveillance for treated breast cancer. So a diagnostic mammogram involves the craniocaudal and mediolateral oblique views with an additional view, for example, a magnification view of a lumpectomy site or a spot tangential view of a palpable lump. Until recently, mammograms were limited to 2 dimensions. However, in 2011, the FDA approved 3D mammography, also known as tomosynthesis. This modality utilizes a moving X-ray source and detector to produce a series of 2-dimensional images that are then synthesized to construct 3D images of breasts with thin slices. This has grown to predominate breast imaging as it not only decreases recall rates but also increases detection when compared to 2D. Additionally, tomosynthesis improves lesion localization and characterization of non-calcified lesions while also improving diagnostic outcomes. The radiation dose can be comparatively higher, though a synthetic 2D image is available to mitigate the increased exposure. Ultrasound is not routinely used for screening, but commonly used for diagnostic follow-up or sonographic evaluation of lesions seen on mammography. It may help to categorize lesions as benign or malignant, identify cysts, supplement unclear mammograms, perform biopsies, assess axillary lymph nodes, or place clips prior to chemotherapy, among other purposes. Breast ultrasound is highly operator dependent, as it is in other settings. MRI is based upon the concept of tumor angiogenesis. Gadolinium is injected and quickly taken up and released by tumor-associated blood vessels that have increased permeability, so this creates a pattern of rapid enhancement and washout. So breast MRI is most often used to determine the extent of disease in newly diagnosed cancers. It's also used to investigate occult primary tumors and screen the opposite breast before undergoing treatment. It's also indicated for screening in high-risk women, particularly those with a lifetime risk greater than 20% for breast cancer, such as women with the BRCA gene, or a strong family history, or a history of chest wall radiation. Lastly, it is also very important in the assessment of silicone implant integrity. The Breast Imaging Reporting and Data System, also known as BI-RADS, was developed in 2013 and published by the ACR in order to standardize the reporting of breast images. Categories are provided for several elements, including breast composition, mass characteristics, symmetry, calcifications, etc. As an example, this image demonstrates several BI-RADS categories for breast density, ranging from almost completely fatty, or category A on the far left, to extremely dense, or category D on the far right. And this concludes the presentation. We want to give a special thanks to Dr. Susan Jordan Turner, who is a breast imager here at Wake Forest, for her contributions.